Hi guys, Dr. Will Adams here, chiropractor at Miami Spine and Performance. We're here for part 3 of our Jiu Jitsu injury prevention series. In part 1, we talked about how we can use our diaphragm to both breathe properly and stabilize properly, right? When we're on the Jiu Jitsu mats and we're training, we want to have great core stability, but we also want to be able to breathe. So we're not bracing hard, but we're creating good intra-abdominal pressure, which is going to protect our lower back and allow us to use our hips effectively when we're on the mats. In video 2, what we talked about was hip stability, right? So being able to feel the muscles on the outside of the hip. A lot of times individuals think that they're using their hip, but really they're using their lower back, right? And that's going to overload the lower back, and that's why we see a lot of back injuries in jiu-jitsu. So I showed you guys a side lying exercise where we're rolling over the hip, and we're not only using the big muscles, but also the small rotator muscles of the hip to move and stabilize, right? And that's going to translate to the mat as far as sweeps, shrimping, bridging, right? All the important things about being a ground player come down to hip stability. What we're going to talk about today is hip mobility, right? So being able to express the hip joint through a large range of motion while controlling that range of motion. Now this is different than flexibility. Flexibility is just how much someone can move me. I'm sure some of you, maybe you've had somebody stack you and put your heels behind your head and you didn't realize you could go that far, but in that position you felt sort of defenseless, like you had no strength in your hips. So what we want to do is we want to not only expand our flexibility, but our active mobility, so that when somebody does put us in a position where our hips might be stacked over us, we've been there before in training and we can use our hips to get out of that position and find a better position. Again, think about guard, sweeps, and things like that. Having good hip mobility helps tremendously with that. Now the exercise that we're going to do, you're going to be lying on your right side, and this is called a controlled articular rotation for the hip, okay? It's going to start with both hands being straight out, knuckles, good pressure, ribs are going to be elevated up off the table, bottom knee at 45 degrees. From here, we're going to bring our knee up as high as you can until you start to feel like you're using the lower back. We're going to bring our leg out into abduction. Again, we're not rotating our entire body, but just the hip. Internally rotate from here. Really a lot of tension through my midline, trying to keep my ribs up off the table. Drop that hip all the way back, being super intentional about all my movements. Coming up, pointing my knee to the ceiling again. Opening the door. And back to hip flexion. Now another thing you can do to mobilize the hip capsule itself is you can actually pause midway through these movements. For example, when I go to hip flexion here, I pause and I just rotate my hip. Again, I'm being super strict. I'm not using my lower back. If you're looking at my upper body, you wouldn't know I was doing anything. Make it a little more challenging. Go to the next position. Again, move the capsule from here. I'm not using my lower back. You can even put your hand on your hip to monitor and make sure that you're doing it strict, okay? So that's the hip controlled articular rotation and the capsule controlled articular rotation. Give those two a try. You'll definitely feel a difference on the mat as far as your hip mobility, and stay tuned for more content. Thanks for watching, guys.